gonna show a little video. I have this old arthroscopy on my Instagram. It's all basically HIPAA protected. This was all consented, folks. Yeah, so these are just demos of what it's like to see what an arthroscopy looks like. For example, this was a rotator cuff repair. I'm showing the video right now of a rotator cuff repair surgery. You can see on my LA Shoulder Instagram page. This was on my profile, but you can see that through one of my posts. And this is what those sutures look like and what the outcome looks like at 3 months for this gentleman. So he was doing really well, and then he progressed really well. And some arthroscopy. I was talking about arthroscopy earlier. This right here is the setup for it. So that's this one right here. You can see the video and what those small incisions look like. And then the video actually on the screen is then showing what I'm looking at on the screen. You can see this is my attention. I'm here on the right. That's my PA over on the left. But you can see I'm managing the green, which is the Arthrex implant. And then the left is the camera. And then this is a case where I'm basically doing a repair. So I was getting videos like this during cases where I could show people what these things are, basically what this is. And that way you can kind of understand it. But basically what arthroscopy and what this does to develop, what you guys do is having those relationships with surgeons where you have to come in to these situations and be able to teach them. So obviously you've developed that over time and through personal relationships. But is there a way that you'll, like, when you're, how do you learn these specifications for things? You really, if I ask you a number, it's a 4.75 millimeter biocomposite swivel lock. You know, it's one of these things where you're just like, boom. Yeah. Even with new stuff, you know all the specs behind it and the measurements. How do you do all that? Do you just look at diagrams, or do you make notes for yourself, or do you read material?
It's repetition. I mean,
How long does it take you? Like a day?
It depends on what you're learning, right?
Yeah, a new product, I mean.
It depends on what it is. I mean,
how complicated it is, or if it's a whole new process.
The length of something.
Yeah, so if it's a new anchor, it's something, a different change in size, it's probably not that big of a deal. There's not a whole lot to learn.
Yeah, conceptually, if it's new, then
Right.
it takes longer because you have to learn the concept. But if it's just memorizing a length or a diameter, I mean, I can reference a technique out online in surgery. I mean, if you're not going to look at me in surgery if you say, hey, how wide is this? And I'm going to say, give me 1 second, pull up something and say, that's this. You're going to say, thank you. You're not going to be like, why didn't you know that? Like,
You know how to access the information, right?
well, yeah, of course.
Yeah.
I mean, it's on the website that everyone uses. So we have that information, and that's, our job is to get you that information. And that's where there's value in having someone in the room with you and making sure that you're getting what you need.
So I think there may be some people who are interested in the whole field of either surgery or medical education, or being a rep themselves. What is it like working with surgeons? Is that a good thing or a bad thing?
I mean, there's lots of different personalities. It's like working with anything, right? I mean, surgeons are humans. You said it, right? You're human.
Is it variable or is it pretty consistent?
It's completely variable.
And I'm an orthopedic surgeon.
Yeah.
So have you worked with general surgeons or always orthopedics?
I've seen some general surgery, so yeah.
You have experience.
Everyone knows that general surgeons are significantly more fun than orthopedic surgeons. Like that's
by definition.
I think that's humans are humans, right? So in any industry, there's going to be different personalities. So
that's definitely true. There tends to be a lot of ego though in the surgical community, especially inside the OR, because you may, there's a lot of people that are intimidated from the OR. Even people that know me, for example, may feel that they aren't at the level of understanding of the implants that I require. I've heard of things like that. Do you know that kind of sentiment where somebody maybe doesn't feel prepared? Like as a rep,
you can be
with a particular surgeon, maybe, for example, and they feel scared.
I'm sure all reps have felt unprepared at some time, because it's, like I said earlier, we're dealing with some of the smartest people that live on this earth. And so there's going to be questions.
Smartest and sometimes most egotistical people on the planet too,
You
right?
said that.
They sometimes go together.
There's going to be times where you don't know the answer,
but they're really smart. Hopefully they're nice and they're not being mean to you on purpose.
Sure.
Or they're just, what? I mean, what? How do you feel about that? Mean surgeons?